So give us a top down on what you guys are doing with your COVID-19. It's called CAP 1002 is the name of the drug, or CAP.
So it's a cell therapy product. It's basically, as he just called it, a chill pill, but it's not a pill, it's an infusion. And so as we talked about last week, and I think everybody's coming to understand, the real danger of COVID is not the virus. Lots of people are getting the virus and getting better. It's those people that end up with what they call cytokine storm, or an hyperinflammatory response, which means that their body starts to rebel against itself and actually causes the ARDS, the lung disease that's most pathogenic. What CAP 1002 does is it releases these tiny little particles. So, think about like scrubbing bubbles or something of that nature that can calm the inflammation down. And it's been pretty successful so far.
So is the storm effect that you discuss, is that mainly because where a body is overreacting? Is that hence Russ's chill pill?
That's exactly right. So, and there's it's well understood pathogenesis at this point, where the virus starts to go away and people's immune system is in such hyper overdrive that sometimes it can't get control of itself. And that's when it starts to attack the lungs, the kidneys. It's called multi-organ system failures and those kinds of things. So if we can stop that or attenuate it, we're going to see a lot more people live, and a lot of people not even go into the ICU. And CAP 1002, we've had some really interesting data from it. We now have long-term survival data relatively for these patients, an 86% survival rate. We lost 2 patients that were really quite sick when we got to them. We're hoping in future clinical efforts to get to people when they're not quite as sick. So maybe right before they would go on a ventilator, but needing oxygen support or something like that. And it's very well documented now. We've been studying this worldwide. So we think we know what to do. We just have to get in there and do it.